Hello, everyone. I'll just give it another minute or so to get a few more people joined in, and then we'll get started. All right. Hello, everyone. Welcome to our industry showcase today, minimizing downtime risk, empowering Canadian healthcare with digital downtime solutions on October 21st, 2025. My name is Madison Lohman, and I will be your host for today. I would like to begin by acknowledging the Indigenous peoples of all the lands that we're on today. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we each call home. We gratefully acknowledge that we are on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. Sorry. And please take a moment to share in the chat the territory you're joining from today. On a technical note, please use the chat or the Q&A section if you are having any technical difficulties, and I will be happy to help you out. We will also have time for Q&A at the end, so please submit your questions at any time, and we will get to them in our Q&A section at the end of the presentation. Today's industry showcase is brought to you by Interlace Health. Thank you very much for sponsoring the session and bringing together this thoughtful discussion. It is now my pleasure to introduce our presenters for today. We have Andrew Nemirovsky, who has over 20 years of experience in the healthcare and healthcare IT fields. He began his career as an emergency department nurse and pivoted to digital transformations, leading implementations and optimizations of digital health systems from coast to coast. Andrew continues to be involved in professional organizations such including CCHL, HIMSS International, HIMSS Eastern Canada chapter, and Digital Health Canada as a chief executive, where he has and continues to participate on various boards and committees helping to strengthen the digital health ecosystem in Canada. We are also joined by Art Nicholas, who has over 20 years of experience bringing innovative healthcare IT solutions to the market by understanding the challenges health systems face. Currently, leading our commercial efforts at Interlace Health as we transition to cloud-based solutions focused on data and signature capture workflows. Previous roles included leading healthcare sales at Nuance Communications, NoteSwift, Novo Dynamics, and Strata Health. And finally, last but not least, we are joined by Anne Hill. Anne is a senior solutions architect at Interlace Health, where she partners with healthcare organizations to optimize patient, provider, and staff workflows through Interlace Health's solutions, services, and integration technologies. So thank you all for coming today, and I will now pass the mic over to Art to get us started.
Great, thank you. Hello and welcome. We really appreciate and want to thank you for joining our session focused on downtime preparedness, specifically for Canadian healthcare providers. Alongside me today, as we mentioned, will be Andrew, who is our Canadian country manager, and Anne, our solution architect, who will be providing us through a walkthrough of the solution that we offer. Andrew brings deep experience with Canadian privacy regulations, accreditation, and the unique operational realities north of the border. Andrew?
Thanks, Art. I'm really excited to discuss the increasing impact of digital downtime across Canadian hospitals and clinics, and how the latest solutions, like the ones we offer, can directly help you overcome those compliance, safety, and operational challenges.
And thank you, Art and Andrew. I'm equally as excited to be showcasing the power of our digital downtime forms and registration during the live demo portion of today's webinar.
All right, so let's start with what we're seeing in Canada. So we all know there's a push for greater digitization across healthcare through EHRs, digital registration, communication tools. It's been very transformative for the past 10, 15, 20 years. But it does mean that if there's any disruptions, whether scheduled or unplanned, it creates a significant compliance and patient safety risk. I've lived through enough downtimes myself to appreciate what these feel like. Key downtime causes in Canada include planned EHR upgrades, cyber incidents, which unfortunately are rising across the globe, including Canada, and routine system maintenance. Each one requires immediate action to document patient care, maintain patient flow, and safeguard data privacy, a top concern under our Canadian privacy laws like PHIPA and PIPEDA. A great example that serendipitously happened yesterday for the entire globe was the AWS outage. It was unprecedented to have something like that go down with no warning, no pre-advance notice, and all of a sudden multiple systems are impacted and people are scrambling to put procedures in place to manage their day-to-day business. And the same thing can happen in healthcare as we move to more and more cloud services. After the 2021 Newfoundland and Labrador health system cyber attack, surveyors from Accreditation Canada began drilling even deeper into how organizations prepare for and respond to these kinds of events. It's no longer enough to have something on paper for downtime protocols. Now you need robust, tested, and easily accessible downtime processes to meet the Momentum accreditation guidelines. Gaps in documentation, location tracking, and patient ID during downtime can immediately flag an organization for non-compliance. The Accreditation Canada Momentum standards are really clear. They include well-documented downtime procedures aren't optional, they're scrutinized. Continuous patient documentation, clear communication, and precise patient ID systems must work even if digital systems go dark. And then lastly, staff must be trained and equipped for these situations. From a surveyor's perspective, it's about seeing the process in action, how you track patients through admits, transfers, and discharges during an outage, and how you reconcile what happened after the fact. Missing links here are more than theoretical. They can jeopardize the ability to deliver safe, consistent care and can delay or impact your organization's accreditation renewal. All right, you are on mute, but that's okay. We'll carry on.
Sorry.
That's all right. It's common for clinics and hospitals to use paper forms as a backup. But what we hear from our Canadian partners and hospitals is that these forms often run into real world issues, and I've lived through multiple of these. There are disorganized or outdated paper packs or binders, illegible entries that can lead to clinical and administrative errors, lost paperwork during high pressure events, and then significant resource drain trying to reconcile and upload all the paper post data outage. More concerning, in an era of patient privacy risk and ransomware, unprotected paper can lead to compliance and security issues. As more Canadian organizations seek to align with these national and provincial standards, digital downtime forms and registration become essential. They allow you to maintain oversight, keep patient info secure, and seamlessly transition back online when your systems come back up.
Okay, this time you can hear me.
Yep.
How does Interlace Health close these gaps? Our digital downtime forms are pre-approved and standardized and can be easily deployed across both acute and non-acute settings. They're always available, even offline, which means you're never caught scrambling to find the right form. And as a Canadian-focused solution, we built alignment with PHIPA and I apologize for butchering this one, PIPEDA, using industry standard encryption and secure local storage. Additionally, we have seamless EHR synchronization post downtime, which eliminates error-prone manual reconciliation, system logs and audit trails required for Accreditation Canada's reviews, demonstrating accountability.
So it's really about making downtime preparedness a lived practice rather than a checkbox. If we touch on what some of the leading Canadian hospitals are doing, they include integrating downtime protocols into emergency preparedness and cybersecurity drills. I know I've done many of those through my career. Training all staff, including floats, part-timers, new hires, so everyone knows what to do and not just during business hours, because unfortunately, most of these things tend to happen in the evening, overnight, when people just aren't around. Another one is regularly testing the forms, both digital and manual, so that nobody's caught off guard and actually off guard, so that people actually know what to do. So including this in your preparedness and your mock downtime exercises, so staff know what to do. And then the last one is auditing these downtime events for continuous improvement. No one's perfect. We all make mistakes, and you can always iterate and make things smoother for your staff and your teams and your patients. Adopting digital downtime tools like Interlace Health can also provide Canadian organizations with customized workflows. And that means really that forms and reporting can match the workflows at your site, your network, or at a regional level. It really depends on your need. And this operational flexibility is key to a diverse healthcare landscape.
With that overview, it's time to see how this works in practice. Anne will walk you through a typical downtime event covering patient registration, documentation, and EHR reintegration using the Interlace Health platform.
Great, thank you, Art. I'm going to turn off my camera and go ahead and share my screen here. Great. Art or yes, can you see my screen?
You're
Great.
good.
Thank you. So really, there are three main pillars of our downtime offering. At the core is the digital form library, digital form repository, where staff can go to access crucial forms, whether those are patient intake forms, clinical documentation forms, or consents, to either print with patient data or be available to complete electronically. Printed forms include both patient and form-specific barcodes to enable error-free scanning back to the EHR when the EHR is available again. In the middle there, the ability to add new patients who arrive during a downtime event into our system to then leverage that same form library to generate those patient forms, wristbands, labels, face sheets, etc., so you can continue care and have positive patient identification. Staff can also access clinical documentation templates like physician order sets, plans of care, etc., and be sure they are using the most up-to-date version of those documents. We really like to say we provide a single source of truth where staff can go to access forms during a downtime event. And there are different ways to interact with digital downtime forms. By printing blank forms, those could be with or without patient demographic data included, depending on if the patient, what was existed prior to that downtime event. Or they can electronically complete forms during the duration of that downtime event. And forms that are electronically completed will be available to sync back to the EHR when it comes back online. So let me show you a couple different flavors here. Pull up. So let's start with the printing aspect. And first, for a single patient. So let's say I'm a cardiology nurse. I'm looking at my patients that are on my cardiology floor. My EHR has gone down. Emma needs to have a procedure where I need to collect a blood consent. I can choose my patient here, easily be brought into the form repository, as well as only to the forms that I have available to me, my user. So you can really limit which forms your staff members have access to based on access I can toggle between a list of all the forms I have access to or my favorites very simply. And I can choose the form that I need and just choose to print. And now, as you'll see, I can print out this form with patient demographic data coming from my EHR, as well as that patient-specific, as well as document-specific barcodes. So I could print this out, get it completed, signed, etc. When the EHR comes back up, this can be scanned back in without the need to manually index because the barcodes do that for me, basically. In addition to being able to print a form on an individual basis, I can also, again, let's assume I'm a nurse on a cardiology floor, I can also choose all my patients and choose to print very easily a form for all my patients. So I can just choose the print button here. In addition to being able to look at my favorites, I can also search for forms by tags, which allows you to group forms together so they're easily located. I'll just search downtime here, and I am now presented with a list of forms that have been tagged as downtime forms. And let's say I need to print a cardiac rehab exercise flow sheet for everyone on my unit during this downtime event. By just selecting all the patients and then that print button, I am now able to print a form for each one of my patients very easily. And again, those barcodes would be included, as well as the demographic information coming from the EHR. As I mentioned earlier, in addition to just being able to print, there's also the ability to digitally complete forms during the entirety of that downtime event. Again, I'll go back to my patient, Miss Lee here, and let's say that I want to start completing a electronic medication administration record. I'm going to go ahead and add that form using the Add Form button. I'm going to again search for the downtime forms, and I'll choose this EMR fillable. And instead of choosing print, I'm going to choose the fill out option. And what you'll see here is a form that can be interacted with. Again, patient's demographic information is defaulting in. If there were allergies that were sent to us from the EMR, we could default that. Same with height and weight. And now I can start filling out this medication administration record. I do not have any drop downs built out in these fields, but just keep in mind that drop downs could be used here as well. I'll just say ibuprofen. That's 100 milligrams. And then this root field actually does have a drop down. Notice I could pick from the drop down there. I can easily say today, and then I can apply my signature using a really nice self-sign feature that applies my pre-configured signature to this downtime medication administration record. And notice the only option for me here is save and close. So this form is meant to be iterated on. So now I can save and close this. And then let's say next nurse or whomever also now needs to document a med that they provided the patient. I can now select this form. Again, choose to fill out all the information that was previously entered would default in here, and I can continue entering different medications, doses, frequencies, etc. throughout the duration of that downtime event. And then after the downtime event, when the EHR is back up and this is ready to be filed, notice there's a required field down here, and forms will not be quote unquote ready to file into the patient's chart until all requirements are met. And once I select that required field, notice that the button here changed to finish and close. When I finish and close this downtime form will now go to a completed status. And when the EMR is back up, it will be automatically delivered to the patient's chart. I'll just finish and close that. So that's sort of for patients who are already exist in Interlace prior to the downtime event. Those are the options that are available. And now let's talk about adding new patients. There is also the ability to add patients that did not exist prior to the downtime event into Interlace, and then be able to generate those patient-specific forms throughout the duration of that downtime event. Let me pull up. So here's a downtime app where your staff will be able to enter information about patients that are presenting during that downtime event. The fields you see here are customizable. I'm going to just change this time here. Are customizable and automatically formatted. So your staff don't have to worry about formatting as they're tabbing through all of these fields. I'll go ahead and enter in some information. I'm not going to complete this all. And a lot of this does depend on, what your downtime process is. Do you assign account numbers, medical record numbers that are dedicated, aside for that downtime event, or do you auto-generate them? So a lot of this will depend on your particular workflow. I'm just going to enter in my patient information here. Really nice type ahead and ability to default information pretty easily within here. You can also use drop downs. We do like to say that we suggest that the downtime app be closely mirrored to your EHR admission screens so that your staff members, it's not too much of a learning curve to go between the two and, they sort of match up with the data. So I can put in, a time here, what kind of accident. I'll just say it's an auto accident. And then, I can just continue putting in information here. And then over here are just different tabs to sort of categorize your information. So I'm going to enter in my patient data. Whoops. Really quickly here. Just to get some information so I can show you how it flows. So I'll skip that. I will put in her address though. I'm going to make her in my hometown here. Oh, good old Boston, Massachusetts. And then, you can put in emergency contact information, insurance information. Again, just keeping in mind that these fields are customizable according to the types of information that your facility would like to collect during the downtime event. And then I would just choose register here, and that adds the patient to the Interlace database. And let me show you what that looks like. Okay, so I'm looking at, let's say I'm a registrar in the emergency department, and I'm looking at a list of patients who are in the emergency department. Let me go ahead and refresh this. And when I do that, you'll see that my patient that I just registered in the Downtime app has now appeared here. And now I can select my patient and choose to print and or fill out any of those forms that are available to me in the Downtime repository. I'm sorry, in the form repository. I will show you one other flavor of, so if again, I'm going to choose my downtime tag. Let's say this is a new patient, just arrived, and I want to be able to label the, I want to be able to wristband the patient. I want to be able to print out labels for the patient. So I can choose that form template after I've chosen my patient and generate a list, and generate labels as well as a wristband template for my patient. So you're going to have positive patient identification as well as a number of labels you can use throughout the duration of that event. And again, that patient will remain in Interlace for any other forms that need to be generated during that downtime event. Could be order sets, as I said earlier, or any type of physician documentation where you want to ensure that your staff are using the most up-to-date version of any of those templates that you have. And that is all I had, Andrew.
Perfect. Thank you very much, Anne. That
You're
was a great
welcome.
demonstration. Love it. So that is really the end of our presentation. Thank you to everyone who joined today. We're really here to support your organizations to meet and exceed Accreditation Canada requirements, help improve patient safety, and build some operational resilience around downtime and what we do there.
Andrew, I think we have a couple of questions that have come in during the course of this. The first one was, has anyone put an actual cost of downtime together?
And we have some metrics we can run. We need to talk to your organization to understand volumes and size and all that sort of thing, but we're happy to do that and figure out essentially return on investment if you invest in one of these solutions, what that looks like. But happy to do that. We've got a few we can do.
And then there was another one. How many resources does Interlace recommend an organization have to keep downtime forms in sync with the EMR? Anne, is that one you might want to take?
That's a good question. You mean, I'm assuming that question refers to how many resources to keep forms in sync. I think one of the beauties of our solution is that we manage that for you. So we would manage those downtime forms for you. So, if there is a need to update a form to keep in sync, then you just let us know and we do that for you. If you're referring to on the back end, I think that's probably varies greatly from hospital to hospital, organization to organization. Andrew, would you add anything else to that?
Yeah, just in my experience, we tend to not look at these downtime binders probably for a year at a time.
Yeah.
I would probably recommend once a quarter have someone go through and validate. But as long as you make that part of a regular routine, and especially if you use us to build and maintain the forms, it makes it really simple. You just send us the updates, and we would manage that for you. So then it becomes very, very small amount of resources required, probably not even a half of an FTE. If that, it becomes part of your daily process.
There's a question about architecture. Where do the downtime forms reside? Is it local PC or a server in a data center? If a local network is down, can these downtime forms be accessed?
So we are cloud-based, so they reside in the cloud. When your EHR is down, or if there's a temporary downtime, there is ability to take those offline. In an extended network downtime, they would be replicated to a local PC or dedicated downtime workstation.
There's a question. Has Interlace been integrated with any Meditech Expanse client, and are downtime forms successfully routed to the eChart?
Yes, absolutely. We are integrated with many Meditech Expanse clients, and yes, when that downtime event is over, they are successfully routed to the eChart. They're basically just pended until that downtime event is over.
I think that's all the questions we have so far.
I see one in Q&A. It says, how do the barcodes work? So I can start, and essentially it's very much how you folks want to design it, but typically we see a document type barcode so that it knows when the system when you scan that paper back in, it knows where in the chart it's supposed to go. And then the second barcode is either a patient level barcode or an encounter level barcode, or I'm assuming we could actually put both if you wanted. Depends on your organization's desire, but one of them is to identify the patient, one to identify where they go in the chart.
Mhm.
And I see one more question, actually two, but they're related. Following up on the Meditech question, does this solution integrate with Oracle Cerner? And then another question, does it integrate with Epic?
Yes, both. Is that an easy enough answer?
Yeah. Yeah.
Yes, we
And
integrate
that
with both of
in a
them.
similar fashion that that I explained with Meditech Expanse.
Mhm. Yep.
I think that's it.
I think so.
Awesome. We do still have plenty of time, so if there are any more questions, please feel free to put them in the chat or the Q&A section, and they can be answered since we've got so much time. But since while we're waiting, I will do our short little satisfaction poll. So you will see on your screen in a second a satisfaction poll, just a quick 1 to 5. We do appreciate everybody's input on your satisfaction during this industry showcase. It does really help us for future showcases and webinars. We love to hear from you guys what you like and what you don't like. So thank you for just taking a second to fill that one out. Perfect. Thank you guys. I will end the poll. And I do see that I think we got another question in there, Art, in the chat.
Yes. How will users access the app? Is there a need for a dedicated downtime PC per department?
Andrew, what's your experience with that one?
So in my experience, well, there's two options here. So if
Mhm.
the internet is still working, then you don't need a dedicated PC because our system would still be connected. If you have a full network downtime, then you would need a dedicated PC. So you essentially run both options. The web version, obviously, you don't need to do anything special for because it's always on. But most hospitals have dedicated PCs for downtime for their EMR already, and we would recommend you use the same one for our solution in addition to your EMR downtime backup, and run them concurrently on that PC. We used to call them fat clients. I don't know that name is still used anymore, but those standalone PCs that have a small database on them are what we would recommend for sites. And you figure out which, how many across how many units. And that's always a bit of a guessing game, but absolutely we could help you with that design.
All
We're caught up.
right. Maybe I'll do a kind of final call for questions and give it a minute or two, just so we can keep the ball rolling. So if anybody has any final questions, please feel free to put them in the chat or the Q&A. Oh, I see another one there. Awesome.
Yes,
So
related question. How does the app license work? Is it per organization or per user?
yeah, so we license per organization. We do Active Directory integration to get your users in there, but it is a per organization license, so it's not a per user. We can talk through billing or how we charge things. We usually price based on patient volume through the organization, which seems to align most closely versus users or number of beds.
If a form needs to be updated, is there an approval process within your system? And where are various archived previous versions stored?
If a form does need to be updated, there is an approval process within our system as well as hopefully on your side as well. And there's a version history that can be viewed, obviously based off of access. You can view previous version histories, and even if you needed to reinstate a previous version, there's the ability to do that as well.
And there was another question, How is the app deployed to the dedicated PCs? Can it be installed remotely? I think that's for when you don't have internet access, that question.
Is
Yes.
that one you can?
Oh, go ahead, Andrew.
No, I was going to say, is that one you can answer, Anne?
Yeah, it would be deployed remotely.
And
And then
then there's a
there's,
follow-on
yeah.
question about keeping those forms up to date on those dedicated devices. Is there an automated push to those devices, and how often does that take place?
Yeah, we would do a sync between, if you have updated forms in your form repository, we would sync to those offline devices, and it is up to you all how often you want that to happen. Of course, our implementation team can make recommendations, but it's up to you to decide how often you want that happen. Is it weekly, monthly, daily?
There was a question about which cloud hosting service that Interlace Health uses. We use Microsoft Azure. And another question that I can answer, is there a limit to the number of forms? No, there is not a limit. We have clients that are using well over 3,000 forms in our system today.
There's a question in there about biggest challenges organizations have implementing the app. So I don't think the app itself is probably the harder part. The harder part is actually deciding what the standard forms are that you're going to upload into it. So if you happen to be a multi-site hospital system like a health authority, or you're a number of hospitals working together on a standardized platform, getting to that common set of forms is the biggest challenge. Once you have that done, implementing our solution is actually relatively light on your team side. Obviously, there's some testing to do. We need to do AD integration, that kind of thing. But the biggest part is making sure you have the forms up to date and ready that you want to have uploaded into the system. Yeah, form standardization. Yeah, it's a challenge.
It forces some optimization work to happen, I think,
Yeah.
throughout the process, for sure.
And our team will help with that. And even if need be, we can bring in partners to assist if you need someone else with more of a clinical informatics lens. But our team does a lot of that standardization work while they're doing implementations, as long as you have copies of them. That's what we need, is copies, and then we can help you with some of that standardization work. Anything else from anyone before we wrap up? Using the app meet the requirements. So using the app helps you meet the Accreditation Canada requirements because it shows that you've got a documented process. You can show the audit trail, and the documentation goes back into the chart in a secure fashion. So meeting the PHIPA and PIPEDA guidelines. So yes, it does help you meet those requirements. You need to look at the specific Qmentum items, but for that one specifically around downtime, it definitely helps.
Correct. ADT feed, HL7, typically ADT feed. Yep.
Yeah, and then back in, if we're sending the documents back in, it's either a fold feed or another HL7 back in with the document to go back into the chart.
Great questions.
And we can support fire, but we find that most EMRs are not quite there yet. So if that is a requirement, it is something we can do as well.
All right, I'm not seeing any more questions. Again, we do still have time. Oh, and I've been proven wrong. Go right ahead.
The question about the time it takes to implement this solution.
Again, I think that depends on, as Andrew mentioned earlier, we find the biggest delay comes from gathering the forms, whether that's, forms that you might want to use uptime versus forms you want to dedicate for use for downtime. But I would say average, or help me out here, I would say average 3 months.
Yeah, once we have the forms, it's typically going
It's
to be
pretty
about
quick.
3 months.
But
Yeah,
yeah.
and that's the entire process, including, go live prep and
Yep.
training.
Mm-hmm.
I know as soon as we say we're going to wrap up, there'll be one last question that comes in, but I think we've got them all.
And now that's
I think so.
why I waited there for a minute.
Yep.
All right, so I'll call it. I'm sure if anybody has any further questions, they can get in contact with any of you and ask the questions. Also, feel free to email the webinars at digitalhealthcanada.com if you have any questions about the showcase, or if you need a way to find contact. I will help you guys out as well. And on that, I will put up our last few slides before we head out today. We do actually have a survey for the industry showcase. It is this QR code on the screen right here. You can scan that. Please, it only takes about 2 minutes. You can scan it right now. We do encourage you to take this because it gives us more in-depth feedback. So if there's anything specific you guys would like to let us know about, please fill it in the survey. We really do appreciate your guys' feedback on that. So I'll leave that there for just a second to do some scanning. And then I will go to the next one, which is for our Digital Health Canada members. So if there's anybody on the call that is not a Digital Health Canada member, one of the benefits of membership is that you can join us on the members community platform, which is a great way to talk to other members, get in contact with them, join working groups. You can access all of our resources and news updates, as well as all of our Webinar Wednesday recordings. So this recording will also be on there as well, including all of our regular Webinar Wednesdays. So if you are looking to get your continuing education credits done, you can watch the videos there to help you out there. So that is another large benefit to joining our membership. So and to all of our members, if you haven't checked out the community yet, you can just log in at digitalhealthcanada.com with your member's email address and password. There is a little tab on the top of the screen that says community, and you can head over there. And then we also have, not just for our members, we have our Digital Health Canada podcast, Digital Health in Canada. It is a monthly podcast that you can access on all podcast platforms. You can also scan the QR code on the screen there to get access to it. We have a recent episode as of, I think, a couple weeks, and we have another one coming out in a week or so. So check that out as well. We've got lots of great podcast guests and lots of great topics. And then finally, we have our upcoming Digital Health Canada events. We have one that's happening in 2 days, which is the Montreal Breakfast. There is still time to register for that, so we would love to see you guys there. We also have a couple of November conferences and meetups in Saskatchewan. And then we also have our New Year events as well. So you can register for all of those at digitalhealthcanada.com as well. And so I would just like to, before we go, say a big thank you again to Interlace Health, specifically to Andrew, Art, and Anne for joining us today. You guys did an amazing job, and thank you guys. Have a great rest of your day to everyone that joined us.
Thanks, everyone.
Thank
Thank
you.
you.